So welcome to our first coronavirus in our series of webinars by Care University. This is part of our Emerging Threats Community of Practice, and the title of today's webinar is Coronavirus, Protecting You and Your Family, First Responder and Family Briefing. I'm Charles Denham. I'll be your facilitator today. I'm chairman of TMIT Global, and you'll meet a number of our team members of our MedTech Bystander Rescue Care team. This program has been put on over the last 72 hours to help a number of you that are interacting with the public and families to address a number of your needs. I'm on slide 3 of the slides. I'm going to remind everybody how they can go and download the slides in just a moment. First off, we'd like to make sure everybody has their WebEx volume all the way up to the max, their computer volume on their computer all the way to the max, and if you have external speakers, to move that to the max, just in case your audio volume is not high enough. In the event that you don't have good volume, and WebEx is being pretty stressed right now, as you can imagine, go to the click on the participants window, and then click on the icon with the telephone icon, and it will give you a toll dial-in number, and then you can dial in by a landline. And as I'll mention in a few minutes, we're going to be recording this program and then posting it on the website for people to come back to and watch and listen to and see other resources. So this is part of a community of practice that we've launched with Emerging Threats. However, we have the world's largest patient safety community of practice, and for 11 years we've been putting on monthly webinars. We're going to follow the same framework we do every month with about 25,000 caregivers around the world. So our purpose statement is we will measure our success by how we protect and enrich the lives of families, patients, and caregivers. And today we're talking about first responders. Thank you to all of you that are participating with us today, and we hope we can really help you protect you and your families. Our mission is to accelerate performance solutions that save lives, save money, and create value in the communities we serve. The 3 icons on the left are MedTech Global. This is our Bystander Rescue Care program, and a number of our team are on putting the webinar on. The Emerging Threats Community of Practice, which we're launching, and one of the threats is epidemics. And Care University is our learning management system that's delivering this today and will continue to deliver it. So if you did not have the slides or wanted to go back and are listening to this and want further resources, go to www.medtechglobal.org, all one word, and you'll come to the website you see on the left. Coronavirus response is up on the menu. We've just put it up there, and when we have future webinars, you can click to attend. Now, this rides on our MedTech Bystander Rescue Care website, for which there are a number of videos that you see on the launch page, and we won't get into the detail, but we're targeting the 8 leading causes of preventable death before emergency responders or first responders arrive. Now, when you click on the coronavirus page, you're going to see the page you see on the left, really small, but I wanted to remind you we're putting a number of videos up, probably one every day or every 2 days, a tour of the CDC website. There's a wonderful coronavirus brief by Dr. Sanjay Gupta, who I know personally. You can trust him. Dr. Fauci, you can trust him. The third is why ICU care is needed. We're addressing when the severe condition occurs, why people go into the ICU, and tell a little bit of the story about respirators. The next box are the downloads. You can download the slides from this web page, and again, it's www.medtechglobal.org. You click on the coronavirus response, and we not only will have the slides there for today's webinar, we have the continuing education credit information for nurses, doctors, pharmacists, and others, because we've been a long-standing accredited program to deliver continuing education for their licenses. And the bottom of the page, there will be related resources. We'll put a number of resources there. We have a checklist for how to take care of seniors and folks in your home and in your community. The next slide, slide 8, is the top part of that page. And so when you click on webinar resources are found below, it's going to jump down to the bottom of that page. We always, in healthcare, we've got to address disclosures, confidential, the disclosures of financial relationships. We're doing a ton of work in this area with our leading organizations, and the disclosures are on this page. But in quick summary, no one has any product, service, pharmacy, or a pharmaceutical or a device relationship with any organization that needed to be declared, and you can see the other information there. Our speakers today, and I'm your facilitator, but your main speaker is Dr. Gregory Botz, who I'll introduce in just a moment, who is from MD Anderson and one of our great leaders of in critical care, and one of the co-founders and developers and our clinical expert on our failure to rescue program targeting those 8 leading causes of death before EMS arrives. Chief William Adcox, also at MD Anderson, is the Chief Security Officer for MD Anderson, will also be a speaker. He's going to do a little bit of an introduction and then finish up at the end for our professional first responders and those at medical centers. And we have a number of wonderful reactors. Dan Ford, a patient advocate, longtime champion of patient safety. Dr. Chris Fox, who's we're so thankful to have Chris, who's our chairman of the emergency medicine department at the University of California, Irvine. Randy Steiner, who's the director of emergency preparedness for the University of California, Irvine. Tom Renner, who's an instructor. We have a recording from him. He's our representative of the EMT community and lifeguard trainer. We've got Mr. David Besch, who's one of our master MedTech trainers. A wonderful teacher and representing our teachers. And then Jennifer Dingman will close as the voice of the patient, which we always have in these webinars that we deliver. So before we get started, we always start with the voice of the patient and families. And Dan Ford is a retired healthcare executive. Dan and a team that meets every Saturday morning, every other week. Please, the speakers, mute your mics. I can hear a little feedback. Dan is part of a team that meets every other Saturday with us over a decade, and was one of the participants in helping hospitals adopt new guidelines that have saved tens of thousands of lives, and it shows that our country really can work. We can have people that are non-medical professionals and can have enormous impact. And Dan always brings us inspirational words. So Dan is going to just speak for a few seconds to voice give us the voice of the patients and families that we serve. Dan?
There's a lot of concern in our communities about the coronavirus, and we're very blessed to have experts this afternoon help us understand the magnitude of the problem and help allay some of these fears. This webinar provides information and an opportunity to work together to serve our communities no matter who we are, just as we have in the patient safety movement. For the last decade, our community of practice has focused on patient safety in our healthcare system. This is an example of how we can broaden our focus to include our caregivers, their families, and our communities, including our vital first responders.
Thank you, Dan. So just a framework that we use in all of the work we do in this area of patient safety, bystander rescue care, and a number of areas are the 4 Ps. And we can all take this to heart. What can we do about prevention? What can we do to be prepared or preparedness before something happens? What do we do to protect ourselves and our loved ones when something does happen? And performance improvement is what can we learn from other countries and other organizations and other communities. And so you'll hear this as what we call a reconciling framework. We apply it through our MedTech Global program, this emerging threats community of practice that we're working on with medical centers, our global outreach through what's called the Global Patient Safety Forum. You'll see a website there that really is our outreach globally. We work with WHO and a number of global leaders. And then Safety Leaders is our program for mainly U.S. Patient safety. We use this framework for everything. Just a quick background on MedTech. When you go to the MedTech site, you'll see information about articles that we've published and about the programs that we're launching in 5 states right now regarding failure to rescue and how to take care of your family and loved ones before our professional first responders arrive, which is about 10 minutes, and what you can do within 3 minutes. And there are a number of articles you can download there, and you'll see Mr. Beshk in the picture there, who's one of our speakers today at a school in Southern California where a lot of this work was pioneered. So you hear a lot about this idea of flattening the curve, and that's right where we are today with this virus, and we're really trying to do everything we can to avoid the surge, but at the same time, today we have a number of you that are in law enforcement. We have volunteers from churches, from schools, in our communities that are serving seniors. We have a number of the our federal officers from a number of different agencies who are on today. All of you are at risk. We want to thank you for having to step up and be in the community and serving our public. But the goal is to keep you safe, keep your family safe. And we have a lot of families on today who are families who know all of us, who may not be in law enforcement, but really appreciate everything you're doing. And so it's in that context that we're focused. This emerging threats community of practice that we've launched globally, and we'll have Chief Adcox be able to kind of give you a context of this, is found, and all of the items are found on a website called Global Patient Safety Forum. You can come back to it and look at it, but we had identified 26 areas of absolute critical importance to our medical centers and our leaders at Mayo Clinic and Cleveland Clinic and a number of our frontline organizations, and readiness for epidemics is one of those topics, so it's right in the sweet spot of the work that we're doing. I have to tell you, it's really a great pleasure, and you hear so much on TV and on the news of these self-aggrandizing statements about the leaders. All I can tell you is that Chief Adcox is absolutely dedicated to the safety and well-being of all the officers that he serves and his community at MD Anderson, a global leader in what we call threat safety science, a pioneer that with Dr. Botz. We talk at least probably 2 or 3 times a day, every day, right through the weekends, on these challenges of these emerging threats. Enough said there. Being the chief security officer at MD Anderson, where I had the opportunity as a radiation oncologist to do my medical oncology training, is absolutely spectacular. It's the #1 medical center treating cancer in the world. He is the chief security officer. He is also the chief of police, serving not only MD Anderson, but thousands of people at the University of Texas Health Science Center at Texas Medical Center. He has many accolades. His bio is on our website. We're not going to get into that. I think the main thing is that this is an absolutely brilliant and dedicated servant to our community, and we'd like to have you, Chief, if you'd give us a context before we have Dr. Botz become our main speaker. Chief?
It's an honor to be with you. What you're going to see here in the next slide when it comes up is the threat safety spectrum. And basically, a little bit of context is all organizations are dealing with this expanding threat spectrum, as you can see here. And in the past, all of our threat assessment and risk management activities had basically evolved around being a tactical focus and looking at very specific issues. And generally, what we were looking at was visible hazards. Well, it became increasingly clear to us that what was needed was a very strategic focus with tactical excellence, and in order to address across the board the growing threat diversity, the range of the threats that are coming at it, and particularly the velocity. So what we needed to do is develop a threat matrix of all of these serious threats by at the same time allowing us to recognize the dependencies, the causal relationships, and in order for us to drive a rapid response towards this harm, so that if we could do our best to prevent the harm, but more importantly is if harm was to come, we could respond very quickly, very effectively, and minimize that impact. So we always utilize, as Dr. Denham has mentioned, the discipline and performance improvement that was pioneered in the patient safety field, aviation, and so forth. And so we use the 4 Ps in order to have a unified, integrated, and basically an embedded approach to our work. So our work in this field here involves us developing multidisciplinary cross-functional teams, the community of practice that Dr. Denham talks about, so that we can have integrated strategies to deal with it. And even the coronavirus, the COVID-19, as you see on the slide, is an example of this threat that was invisible. People didn't know that was coming. But this is what we're talking about in terms of an emerging threat, and this is why the healthcare threat safety spectrum is so important. So I welcome everyone today, and hopefully you'll get a lot of good information.
Thank you, Chief, and we'll have you really drill down for our professional first responders and law enforcement, and I think what you'll share later gives a perspective to our families that aren't in law enforcement and are just interacting with medical centers. I think it's going to provide some terrific insights on when you go to the medical center, you've got someone sick and you're interacting with a major medical center. So Dr. Greg Botz is a terrific academician. He is a critical care doctor who's taking care of the sickest patients in the world. Those are cancer patients who are suffering cancer and in the ICU. And I always say how proud I am to know a guy who will then get on an airplane and fly to Stanford and then fly in Life Flight and teach residents and take care of patients at Stanford Medical Center. He's a professor in the Department of Critical Care at the University of Texas at MD Anderson. Got his degree from George Washington University School of Medicine. He has had additional training and his residency training at Stanford. One of the rare people that has had a fellowship, which is extra training in the area and in immersive simulation. And we call on him in the MedTech program that we now, as I say, is going global in 5 states. And we call on him as our clinical expert for that. He is right now just off of being on call, and over the last 72 hours has prepared this presentation for you with all the latest information. And even this morning, we have further updates on testing and a number of different things. So we'll be posting quite a bit on that area. However, what we like to thank him for is taking time away from the critical care of the patients that he and Chief Adcox are taking care of to give us this briefing and continue to update us. The whole MedTech program evolved out of a conversation of his passion. He said, listen, hey, we've got a lot of problems with active shooter events and critical issues. Can I suggest something to you? When I was working at Texas Medical Center with the major institutions there, and that's how that program evolved. So, Greg, thank you for your passion. Thanks for taking time off away from patients while you've been on call, and thank you for giving us a deep dive now and what we can do to protect ourselves, our families, and most importantly, our first responders.
Thanks, Dr. Denham. It's certainly a pleasure to be here with you today. I'd like to present some material about the coronavirus event that's going on around us now and talk about protecting you and your family. So the first thing that I want to say is that I have no relevant conflicts of interest or financial relationships to disclose, and I am an employee of the University of Texas MD Anderson Cancer Center. Therefore, I'm an employee of the state of Texas, so the views and opinions that I'm going to express today are my own, and they don't necessarily represent the views and opinions of MD Anderson or the University of Texas or the state of Texas in general. So unless you've been living under a rock for the last 2 weeks, you've probably heard about the coronavirus. I think there's a lot of anxiety and apprehension about what's happening and what is to come. I hope to spend a little bit of time this morning just giving you information about the coronavirus and our response that might help allay some of those fears. I want to give some background information, describe the current situation. While doing that, I want to maybe point out what is fact and what is fiction. I want to concentrate a little bit on what you can do to stay safe and then how you can protect yourself and your families. I think the first thing to say is that there's a tremendous amount of fear about the coronavirus epidemic that's going on around us. And That's a natural human response. And I think one of the ways that we can manage or mitigate that fear is to have information that helps us both understand and manage the situation that's going on around us. So FDR was really true when he said the only thing that we have to fear is fear itself. In healthcare, we think about things that cause infection in the body in 4 categories: bacteria, viruses, fungus, and parasites. And I'm going to leave parasites out completely because it really doesn't have anything to do with what we're talking about today. Bacteria are, go back a slide. Bacteria are responsible for a number of infections that we are familiar with, like staph and strep infections, strep infections. They are cellular organisms that are closely related to what animal cells look like. They have a cell wall and material inside, including a nucleus, and they go about their business. They can actually replicate and divide and amplify themselves. The fungi or fungus that we have that infect people, we often think about yeast infections or serious fungal infections, and they are quite serious infections if they take place. The cells of a fungus are a lot like plant cells in that they have a very hard cell wall around them that protects them, and they are able to replicate and divide and multiply their numbers. The viruses, though, are quite different. They are not able to replicate. They aren't able to divide and reproduce themselves. They have to infect a cell in order to do that. Next slide. We're all familiar with the flu season that comes every year. We often get flu shots and prepare for the annual exposure to. We don't get it. Next slide. We've had a lot of experience with the flu over the years. We know the signs and symptoms that typically accompany the flu, like headache and cough, sore throat, maybe a runny nose and sneezing, often muscle aches and joint aches, and oftentimes we have a fever associated with that. Now, the flu happens over the entire globe. Annually, about somewhere between 150 and 800,000 people get admitted to the hospital each year with signs and symptoms of the flu. Of that, about maybe 16 to 80,000 people die each year. We've had lots of strategies to try to mitigate the impact of the flu by giving people the flu shot each year to try to reduce the chances of getting the common flu bug of the year. We have antivirals that sometimes can be used to reduce the signs and symptoms. And we have strategies like cohorting, separation, good hand hygiene practices that help to reduce the chance of spread. But lo and behold, last December, something new emerged, something that we haven't seen before. It's a coronavirus that is quite a nasty little bug. It's called a coronavirus because if you look at it under the microscope, it kind of looks like it has a crown around it, or a corona. You can see on this very amplified picture or magnified picture that there are these spikes on its surface that are used to attach themselves to the cell walls that they may invade. Next slide. The proteins that are on the surface are specific to different types of proteins on cell surfaces, and this is how they attach themselves to specific tissues and invade the cells themselves. Next slide. How do the virus particles amplify themselves? Well, they have to get inside the cell. They invade the cell, go in and invade the nucleus where the machinery for replication is housed, and they use it like a factory to turn out many, many copies of themselves, and then eventually cause the cell to die and burst, and then these new particles are released into the tissue and into the system to further infect cells or to be coughed or moved out with breathing and infect other people. Next slide. Now, the interesting thing about the coronaviruses is that they are typically not found in humans at all times. In fact, the reservoir for the coronaviruses are typically in animals. And so there may be an odd chance that a human may be infected by an animal either by having a bite or eating infected tissue, and then that person may become infected. And most often that's limited to that person. But sometimes there's transmission from that infected person to others, and that can amplify into more and more people in the population. If there's a large number of people who are infected with the virus, then we call that an epidemic. Because of our global economy and global transportation, it's rather easy these days for a large number of infected people to move about the globe and cause further infection in faraway places. So the pandemic that we talk about now is really just an epidemic that happens in 2 or more places. So the reservoir for the coronavirus that we're talking about now, the COVID-19 virus, is actually in bats. Of all of the coronaviruses that are known, 7 of them will infect humans. The first 4 are very common viruses that are responsible for what we usually call the common cold. They come in, make us sick for a little bit, and they go away. They don't cause any long-lasting harm. But the 3 at the bottom are very significant, virulent viruses that have caused outbreaks of disease over the last 20 years or so. The first was the SARS-CoV virus, or severe acute respiratory syndrome virus, that emerged first in China and then across other areas, including North America, in 2002. The MERS-CoV virus, or Middle East Respiratory Syndrome virus, emerged in 2012 in the Middle East, predominantly in Saudi Arabia, and caused a significant amount of disease and morbidity in people in that population, but it did not spread widely across the globe. What we're seeing now is the SARS-CoV-2 virus, or the novel coronavirus that we commonly now call the COVID-19. I just want to draw a distinction. The virus itself is called SARS-CoV-2. That's its scientific designation at the moment. But the disease that it causes is called COVID-19. And that's the pandemic that we're seeing currently. A lot of times you'll see it used interchangeably. So if you see either SARS-CoV-2 or COVID-19, it's really talking about the same thing. Now, these respiratory viruses tend to attack the respiratory system in the human. They attack the moist membranes in the nasopharynx or the oral cavity, or even down farther into the trachea and lungs. Now, typically, the common flu virus and the common cold virus tend to attack the tissues in the upper airways, in the nose, mouth, and the tissues above the vocal cords. And so that's why the flu often gives you a runny nose and packed sinuses, gives you a headache and things like that, whereas the coronavirus that we're dealing with now is predominantly a lower respiratory phenomenon. It attacks the cells in the trachea and in the lungs, and because of that, it has much more serious consequences for respiratory function that we're seeing in people who are infected. The most common symptoms are listed here. This is from a group of 56,000 patients from China who had laboratory-confirmed COVID-19. The most common symptoms are a fever, usually greater than 100.4. Notably, they have a dry cough because of the infection of the lower respiratory system. That's oftentimes associated with shortness of breath or difficulty breathing and even low oxygen levels. You can also have the other signs and symptoms that one would see with the usual flu virus. Next slide. So here's an example of a chest X-ray in someone who has a pneumonia or an infection in the lower respiratory system. On the left-hand side is a normal chest X-ray, and you can see ribs and the heart. You can see lungs on either side, and the darkness there is air filling the lungs, and the X-rays pass through. And you can see that there's sort of uniform darkness across both sides. And on the right-hand side, you see someone who's got a significant amount of lung injury here. There's a lot of what looks like cotton balls or fluffy white patches that are fluid and debris from an infection that we commonly call a pneumonia. The Chinese showed us that a sensitive way to detect the coronavirus infected patients, if we didn't have enough testing kits, was to do a CT scan of the chest. So we see here a normal CT scan of the chest on the left. The way that we read these is we imagine we're standing at the person's foot and we're looking up their body towards their head, and the CT scanner takes slices from the head down towards the feet. So this is a slice from the middle of the chest. You can see in the middle there is the trachea and the esophagus, and also the heart and blood vessels. And on either side, you see a rather uniform and sharp lung tissue with blood vessels and airways, bronchus throughout. On the right-hand side, you see someone with a coronavirus that has what we called ground glass pneumonia. In other words, those infiltrates that you see on the left-hand side kind of look like ground glass in the middle of the tissue. That's different from what we might see with other pneumonias where it's sort of a solid white feature. And so this is something that's a little bit more indicative of the coronavirus. So here's CT scans from patients in China during their initial onset of the coronavirus epidemic. And you can see on the top, this is from someone who had symptoms begin about 5 days ago, and there's a significant amount of ground glass opacification in the lungs that both interfere with gas exchange because this material is filling the air sacs where gas exchange takes place, but also the lung becomes kind of stiff and boggy with all of this material. It makes it kind of hard to take a breath in and out. On the bottom pane, we see someone whose symptoms have actually resolved. Their fever is gone and their cough is gone, but they have a residual amount of this ground glass opacification that likely takes much longer to resolve. Now, what sort of range of ages and what sort of mortality figures have we learned from the early epidemic in China? It seems that no age is spared from infection with the coronavirus, although you can see that the younger population, say below the age of 18, has a relatively sparse number of infections. They are there, but they're relatively lower than what we see in the normal population. But you can see that it infects people from the 20s up to their 80s. The important thing to consider here is that the mortality or the death rate from the COVID-19 is predominantly in older populations. It's predominantly in people 60 and older, and it's in people with chronic health issues like heart disease, lung disease, diabetes, and kidney problems. And this slide describes the disease spectrum. So how bad is it? How bad does it get? And thankfully, the majority of people who are infected with this coronavirus have mild symptoms. About 80% of the people who are infected, who have been confirmed by laboratory analysis, have mild symptoms. In fact, they describe it as symptoms that are likely less than what they would have with a regular flu. And in these people, there were no fatalities, there were no deaths. All of them recovered from their symptoms. About 15% go on to have not only the mild symptoms, but more severe symptoms with difficult or labored breathing, decrease in their oxygen levels because of the pneumonia that develops and makes it difficult for gas exchange to take place. These people require hospitalization because they can deteriorate quickly. Now, of these people that were in the severe group who received supplemental oxygen and supportive care, none of them died. All of them recovered, but they required some intensive care during that time. The critical patients are about 5% of the overall total of people who are corona positive. They require intensive care and often life support with mechanical ventilation because they progress to have respiratory failure or the failure of the ability to oxygenate and ventilate. They often have signs and symptoms of septic shock and can develop multiple organ failure. About half of these patients died. Now, of the whole cohort of people who get the coronavirus, the mortality is only about 2%. And that number is a moving target because it really only takes into account those people that were actually tested. We don't know what the denominator is in the overall cohort of people that were infected, so that number may change somewhat, but that's certainly a lot higher than what we see in the seasonal flu. The highest risk of mortality is in those greater than 80 and those with pre-existing heart disease. And the numbers are really limited because of the availability of testing equipment. If we look at the incubation period, what's the timeline for this infection? The incubation period describes the time from exposure until symptoms occur. It can happen anywhere between 2 and 14 days. The average is about 5 days. The infective period, or how long are you contagious, is not entirely clear. Certainly while you have symptoms, you are contagious. You can spread this to other people. There's some emerging evidence that it might be infective before the onset of symptoms, but that's not entirely proven yet. They're certainly working on that. And after the symptom goes away, certainly we believe that the ability to infect others goes away also. The typical length of time from the onset of symptoms until resolution of symptoms is on the order of 2 weeks. And an important consideration that we aren't sure of yet is, does having an infection with the coronavirus give you post-infection immunity? When you get the flu, you are then immune to that strain of flu forever after. Your body builds up an immunity to it. We don't know if you get a post-infection immunity to the coronavirus, and that has implications because it means that people who were previously infected could get infected again and cause additional spread. Next slide. What about range from person to person? An important consideration, something that you need to think about, perhaps something that can help reduce some of the fear. In order to be infected with the coronavirus, the virus has to have contact with your mucous membranes, your mouth, your nose, your eyes. If someone sneezes and it gets on your pants, it gets on your arm, but it doesn't get into your mouth or nose or eyes, it will not infect you. But the problem is that about 44 times a minute or an hour, I can't remember the number, maybe 44 times per hour, people reach up and touch their face. They rub their nose, they rub their eyes, and that's a significant risk to spread virus that may be on your hands and not causing an infection to then gain entry into your mucous membranes. The coronavirus spreads mainly with respiratory droplets, and you can see on the figure on the left, this is an example of respiratory droplets that people emit when they're breathing or coughing or sneezing. Fortunately, the SARS-CoV-2 virus is considered a large infectious droplet, so it doesn't spread far and wide with normal breathing. A single sneeze can unleash 40,000 droplets and over a rather large diameter. That's why we want people to have social distance. That's why we want people to stay at least 6 feet apart from each other, because we don't want the normal breathing that people who might be infected have to cause the virus to contact your mucous membranes and cause infection to you. Now, the SARS-CoV exists on surfaces, but we're not sure how effective that is. It can last for hours to days, so having good hygiene and regularly cleaning the surfaces around you with a bactericidal or a virucidal wipe is certainly an important consideration. There's also viral shedding noted in the stool, but we don't know yet about whether that virus is actually infective or if it's just debris from the infectious process. So here's an example of why we want people who are infected to cover their mouth, sneeze or cough into your elbow. If you have signs and symptoms, wear a mask so that this carpet bombing of viral particles doesn't take place and contaminate the environment and cause the infection to spread to many, many more people. What about our current situation? The coronavirus is now found in all states in the United States, some more so than others. Certainly Washington State, California, and New York have a very high burden of patients who are sick with the coronavirus, but it's everywhere, and it's likely to continue to grow. It started in China, in the Hubei province, in a large city called Wuhan. Next slide. It's thought that the origin of the coronavirus was in the wet market in Wuhan, where people go to buy both domestic and exotic animals for consumption. You can see on the right-hand side at the bottom, there's a board describing the cost for a variety of different animals that people consume, snakes, foxes, all sorts of exotic animals that we may not eat on a regular basis. And you can see that bats are also something that's sold in those markets. Next slide. Yeah, bat soup is a delicacy in China. I don't think many of us would consider chewing on a bat, but that may be how the virus got from the reservoir in the bat into a human and launched the spread and epidemic that we're seeing currently. What we know about the spread of the coronavirus is that it started in China and amplified very quickly. The Chinese were very quick to quarantine a very large section of the Hubei province to try to reduce the spread across other areas, but inevitably it did spread, especially by people who were traveling from China to other areas of the world. You can see since February, it's hit in a number of different places and risen to the level of a pandemic. Next slide. After the rise in infections in China, the next phase was in South Korea, Italy, and Iran, and you can see the rather dramatic rise in the number of cases that they saw sort of at the end of February and early into March. The third wave is now in much of Europe and in parts of Asia. The United States is in here, and you can see how our number of cases are continuing to rise, and I would expect that that will continue to rise for some time. China is now seeing sort of a decrease in the number of cases, and so there's hope that we'll hit a peak and start to decrease. So I want to change to what can we do to stay safe? And the first thing I think we need to do is sort of take a deep breath after hearing all of that bad news about this pandemic and the fact that we feel sort of hopeless about what we can do about it. There are things we can do to try to mitigate or reduce the chances of getting infected or having our family get infected. So what can we do to stay safe? Our public health strategy in trying to deal with a pandemic flu outbreak focuses on individuals and populations. Our focus on individuals is on detecting and treating infections and preventing spread. That it means isolating people so that we don't spread those that are infected to those who are not. If we overwhelm our system, we could cohort people who do have the virus and keep them away from people who don't. The treatment of the coronavirus disease is predominantly supportive care unless we have people that get into the severe or critical phase of the disease where they have respiratory problems, in which we might have to support them for some time with advanced life support like ventilators. Another particular focus of the individual plan is to try to protect our healthcare workforce, because if they get infected, then we are certainly going to see a deterioration in our ability to care for people who need us to provide the supportive care as they are dealing with the coronavirus disease. When we talk about populations, it's all about trying to reduce the spread. All of the things that we're doing with social distancing, with quarantines, with closing places where people might gather is trying to reduce the spread of the virus at an accelerated rate. There's efforts undergoing now to the vaccine that can help to prevent infection or further infection in patients who are not currently infected. And the theme there is flattening the curve, and you've heard a little bit about that. I'm going to talk about that in the next slide or two. So here's an example of a man in Italy. You may have seen this on the internet. He decided that to enforce his social distance of at least 6 feet, he made a disc out of cardboard and put some suspender straps on it, and no one can get closer to him than about 6 feet. This is what we want people to do because, as I said, the droplet spread on average for the large particles from the coronavirus tend to be in the 1 to 3 feet, maybe as far as 6 feet in general, as long as people aren't directly coughing or sneezing on you. Keep that 6 feet distance to try to reduce the spread. And this is the example of flattening the curve. I want to point your attention to the blue curve, and that's what we would expect the number of cases to do if we didn't have any quarantine or the social distance measures in place. we would see a very sharp rise in the number of cases with an overwhelming of our social and medical systems. You can see the red line, that hash line there, is sort of the maximum capacity of our medical sick people. That includes the number of beds that are available in hospitals, the number of ICU beds that are available, and the number of ventilators that are available to take care of those people who have advanced or serious disease causing a compromise of their respiratory system. What we're trying to do is flatten the curve and extend it over time so we don't absolutely overwhelm the medical care system. That's what happened in Italy. They have been totally overrun, and they have very limited ability to care for people in the hospital systems that they have in place. In fact, a number of the healthcare providers have the coronavirus, and one of the leaders in the coronavirus epidemic plan for Italy actually died from the coronavirus himself. So what can you do to stay safe? You know, I'm particularly interested in our colleagues in the first responder or the pre-hospital or public-facing functions in our community, both law enforcement, EMS, volunteer providers in the community that provide both security and health assistance, especially to our vulnerable populations like our school kids, our chronically ill neighbors, and the elderly who are certainly at significant risk with this coronavirus. I would point you to first a great reference for you to use information, and that's the CDC website, particularly dedicated to the coronavirus. You can get there at cdc.gov/coronavirus. I know Dr. Denham described a videotape tour of this website that shows you what material is available there. I would encourage you to look at that after the webinar is completed. It speaks specifically to how to protect yourself and what to do if you think you're sick. How to protect yourself is how do you prevent the spread of this virus in yourself, your family, and in your community, and that includes the social distancing and other strategies to try to flatten the curve. There's some information there on how to protect your family, how to get your family and home ready for this pandemic that's happening, and some specific information about the risks in children and pregnant women, especially pregnant women or postpartum women who are currently breastfeeding. Next slide. It also has information about how to get your home ready, how to isolate within your own home, clean and disinfect, and have a checklist of things that you need to have in case you are at home for an extended period of time, or if someone in your household does come down with the coronavirus. Next slide. Also on this website is some specific guidance for law enforcement on things that are specific to their environment, including protecting yourself from exposure, recommendations for the kind of personal protective equipment you should use, and also how you should behave and what measures you should take if you've had to have contact with infected with the coronavirus. Again, in order to protect yourself, maintain a distance of at least 6 feet. Use proper hand hygiene. Use soap and water for at least 20 seconds. In my daughter's kindergarten class, that was singing happy birthday twice. Not everybody takes the time to do that for a sufficient amount of time. Soap will kill the coronavirus. It interrupts the envelope around the virus and renders it ineffective. If you don't have soap and water, use a alcohol-based hand sanitizer that has at least 60% alcohol. I know it's hard to do. I'm guilty of this myself, but try not to touch your face with unwashed hands. Try not to get anything near your mucous membranes that might increase the risk that you will be infected. Now, in the hospital, we're lucky because our patients are sort of in one place. We have the ability to put on our medical battle rattle of protective equipment, gowns and gloves and masks and goggles when we are interacting with patients to try to reduce the risk of spread. That's not always possible in our law enforcement and EMS worlds. Here's some recommendations for personal protective equipment. Obviously, having disposable gloves, a gown if possible, or coveralls if you can. Sometimes that's not possible because of your duty gear. Having an N95 mask or a simple surgical mask is certainly recommended as well, and having eye protection to prevent any material from being splashed in your eyes. If close contact does occur, it gives you some information about cleaning and disinfecting your duty gear to make sure that it isn't a source for further infection. My recommendation on the right is to put together a personal kit that you can have available to you in your work. That includes gloves and eye protection, surgical mask or N95 mask, some sort of a gown to reduce the likelihood that you'll get infective material on your clothing, having hand sanitizer so that you can clean your hands if they become in contact with secretions or someone who may be infected, and a trash bag where you can isolate some of those things once you've used them. I also recommend that you consider having a contact kit if you do have to come in contact with someone who is suspected or is known to have the coronavirus infection. That includes having some extra surgical masks that you can put on the person to reduce the risk that they will spread virus with coughing or sneezing or heavy breathing. Also having extra gloves that you can use while you're in contact with the person that you can take off and keep a pair of gloves on to keep yourself safe. For our emergency medical services personnel, there's been a lot of guidance over the last few years from the CDC about protective strategies for high-risk infection materials, but they've revised it somewhat for the COVID-19 epidemic in the U.S. It includes some considerations for patient assessment to reduce the risk that you will be contaminated with infective material. It includes specific recommendations for personal protective equipment, which really isn't that much different from what we use with universal precautions for people that we interact with in the community who might have an highly infective bug. It has guidance on transporting someone who may have investigation for coronavirus or has confirmed coronavirus when they need to be moved either from the community to a healthcare facilities. There's also guidance for cleaning the EMS transport vehicle to prevent the virus from staying on our work environment and causing infection to the crew or a subsequent patient who's being transported. So how do we go about protecting your family? I break it down into these very simple considerations. First, have good hand hygiene or hygiene practices at work. Be vigilant about that. Make sure that you try not to touch your face as much as you can. Wash your hands frequently. If you think that your duty gear has been contaminated, disinfected as needed, we'll talk a little bit about that in a minute. A good practice is to, when you get home, change out of your work clothes and into some home clothes, and don't mix them so that the likelihood of contaminating your home is less. When I first started at MD Anderson and in the ICU, a place where there's lots of multi-organisms in our very sick cancer patients, my wife would routinely make me take off my clothes in the garage before I came in. And sometimes I was lucky she let me close the door before I did that. But she wanted me to leave the contaminated clothes outside, walk directly through the house without touching anybody or anything, and get in the shower and clean off with soap to reduce the likelihood that I would contaminate my home or my family. At the time, we had a newborn who was particularly at risk for infection. Also, watch for symptoms. If you have a fever, if you feel like you have a flu coming on, recognize that and isolate yourself. The signs and symptoms that are important are listed here: a fever greater than 100.4 or a subjective fever if you feel like a fever is coming on. If you develop a dry cough, fatigue, muscle aches, the usual seasonal flu symptoms that we see. Of particular concern is if you develop shortness of breath. If you do find those things, you need to do several things pretty quickly. First of all, I would isolate yourself from the rest of your family. Call your doctor for advice or a plan. Don't go to the doctor to be seen because you'll then perhaps contaminate the healthcare environment. Put on a surgical mask so the likelihood that you'll spread virus is reduced. Cover your cough and sneezes as you would do always. Continue to wash your hands often. Stay away from others in your home. Use the home isolation technique. Maybe stay and sleep in a separate room and don't mix with the family. Don't share personal household items. Have your own cup and plate and silverware. Use a separate towel or set of towels that don't get mixed in with the rest of the family. Clean surfaces frequently, at least daily, with a disinfectant material, a wipe or a solution. It's very important, just like with the regular flu, that you stay hydrated, and you can use Tylenol or ibuprofen for fever and pain. I know there's some controversy about the use of ibuprofen with a viral illness. That's not entirely clear at the moment, so I think that it's probably safe at the moment to continue to use ibuprofen in pain. Stay tuned, there might be more information. What really is kind of a mystery to me is this pandemic we're seeing where the grocery stores are being cleared out of near everything. I'll say to you that that's human nature. When there's a threat, either real or perceived, we kind of circle to do things in order to protect ourselves and others, and that's a natural response. Just realize that the food chain, the supply chain for food in our communities is not disrupted. The water is still clean, the electricity still works, the trucks are still bringing food to the stores, and so we're not going to be in a circumstance for long where the store shelves are empty of the things that we need. Bottled water and hand sanitizer went off the shelves relatively quickly, so I want to talk about some things that you can do there. For those of you that can't get any hand sanitizer, I'm going to give you an amateur chemistry lesson and teach you how to make your own. Here's a recipe on the left that calls for 70% rubbing alcohol, 2/3 of a cup, and 1/3 of a cup of aloe vera gel. If you're into aromatherapy, you can mix in some drops of essential oils, but just plain is fine. Mix that in a bowl well, and then pour it into another bottle or empty hand sanitizer bottle or liquid soap bottle. If you have to, just put it into an empty water bottle so that you can use that as an effective hand sanitizer both at home and in the community. Certainly all of the readily available ingredients that one would use to make some of these things quickly disappeared off of Amazon.com, but you can buy some little containers with flip tops when they're available again to both store and carry your homemade hand sanitizer. As far as decontamination, if you don't have Lysol or Clorox wipes, which are brand names for wipes that are impregnated with a disinfectant solution, you can make your own. You can use common household bleach, which is usually a 5% solution of sodium hypochlorite. You want to dilute that with water at various concentrations to make a disinfectant solution that you can use to wipe on surfaces and use to clean infected or contaminated clothing, etc. Can you go back a slide? The typical mix for bleach concentrations depends on what you're using it for. If you're using it for skin decontamination, you want to use a very dilute solution of 1 to 100 bleach concentration. That is using 1 part bleach mixed with 99 parts water, a very dilute solution that will both disinfect your skin but not cause any of the irritation or burns that you get with a more concentrated concentration. Surface decontamination, you want something a little bit more concentrated. That would be a 1 to 50 bleach concentration, 1 part bleach and 49 parts water. If you're cleaning contaminated clothing or linens, you want to use a much more concentrated mixture with a 1 to 10 concentration. Now, fortunately, most of the modern washing machines in our homes have a container where you can pour bleach in, and it will mix it in a less concentrated manner into our clothes. Again, reminder, please never use undiluted bleach because it can cause serious injuries both to your mucous membranes and to your skin itself. How long will this last? I don't know. I really don't know. There's lots of projections, and that's all they are. We see that the peak has been reached in the number of infections that are occurring in China. It's not zero, but it's on the downward slide. I think we're in for several weeks, if not several months, of this pandemic in the United States. Again, I'm more in favor of having it more prolonged if we can flatten the curve and not overwhelm our healthcare system, because if we do overwhelm our healthcare system, patients are going to unnecessarily die because we don't have the resources to care for them. Your guess is as good as mine. So thank you very much for your attention. My advice to you is to try to remain calm. Use this information to try to allay some of the fears that we have. Use these practices to try to keep yourself and your family safe, and use your head, stop the spread. Thank you very much.
Thank you so much, Greg. And we are going to have a Q&A session after we have our reactors respond and kind of give their perspectives. And before we go to Chief Adcox section, I just want to let you know that we'll be addressing a number of things regarding seniors and other questions and frequently asked questions that we get. So we're going to be asking Dr. Botz and Chief Adcox and our other speakers like Dr. Fox and Randy Steiner and David Besch questions that they may be able to field. It's a real honor to now have Chief Adcox address issues from the security leaders' perspective. So those that are families that we have on that are not in law enforcement and not involved in that area, still pay attention to what Chief Adcox has to say, because he's going to give you the perspective regarding what's happening at our medical centers, and what he's briefing our law enforcement and first responders about actually applies to us, because we are the patients and families that flow through that system. The other thing we often say is that everyone is a patient and everyone can be a caregiver, and that's what's happening in our community today. Chief Adcox is the chief of police of a large police department covering the Texas Medical Center in Houston and the University of Texas students and the caregivers and the entire footprint there, but also MD Anderson, where he is the chief security officer for MD Anderson Cancer Center. It's ranked #1 in the country by U.S. News and World Report. And chief has an MBA. He's had a number of accolades. You can look at him, his bio on our website. We won't get into that. However, we want to let you know that he is far beyond what we think about sometimes when we think about law enforcement of guns, gates, and guards. He is leading world-class cross-functional teams, not only there locally, but involved in this emerging threats collaborative that we will be addressing and working with global leaders on in the months and the weeks and the years ahead. Chief, please take us through your perspective as it applies to what's going on at our medical centers. And Chief, you can highlight them. You don't need to read everything on the slides. We put all the detail that you've sent us on the slides for you.
Well, thank you, Chuck. Did you want to go to Dr. Fox, or do you want me to go?
Randy Steiner, can you stay on for a few minutes?
Yeah, Chuck, I'm here.
Yeah, Stan. When we get done going through what Chief Adcox covers, maybe I'll swing to you, and then we'll address what we can do for our seniors in the community in case you have to go.
Okay.
But go ahead, Chief.
Well, what I wanted to do is, and apologize for the poor slides, these are just really quickly put together, but to explain to all of us what you're going to be seeing when you go to the hospital or to a major medical center. So you're going to see very limited access points. You're not going to be able to get into the places you used to. There's probably going to be outside screening. There'll be a tent, a structure where they're going to screen you there, ask you a series of questions, and you can go in. You're going to see some delays. Obviously, they're limiting visitors that will be able to go with you. You're going to see that they don't want any visitors under the age of 18. You're seeing a lot of cancellation of elective surgery, things and procedures and so forth that can wait, and that's obvious for reasons because you're having people that are getting sick and less clinicians, people to take care of you, resources, blood, beds, and so forth, equipment. So you're seeing a lot of things are being done to try to reduce the impact on the different hospitals. They're setting up off-site screening and testing in most of the cities, and that just so that if people are worried, they can go somewhere, get tested, go home, self-quarantine, because there isn't really an effective treatment that's been coming out yet, and so that you can get, they'll let you know whether you have the disease or not, so you're not overwhelming the hospitals and even the urgent care clinics. Again, they're practicing social distancing. You're going to see where they just don't want people getting around each other. Food services, you're not going to see the cafeterias. It's just going to be a grab and go, if anything. They're limiting valet services and so forth. And it's just the way it is. It's what we're all finding, and that's what we're seeing. I won't go into much of this. It's just that there's some changing challenges for those that are working in the hospital security. Stuff that was just very cheap and not really of value. You're seeing bleach that's coming up missing now. There's a lot of panic. So there's things that weren't valuable now are valuable within these hospitals, and they're having to set up specific points now, securing things, make sure the inventories are there. Again, security is being asked to help to secure the access points, and again, all the things that you can see on that list, and I won't go through them all. Police and security. This affects us all. The police departments are having to change the way they do business. Jails are turning around, and these are generalizations. They're not taking non-violent criminals and misdemeanors, they're actually emptying out. People have 30 days left on their sentence, for example, and they're going to go ahead and turn them out. They're just trying to reduce the population and any spread of the disease. The diversion programs that were for like habitual trespassers, intoxicated individuals, a lot of those are closing. They're going to be asking you to report what's going on with you ahead of time. You'll see alternative responses to your home, and even for first responders that they're being asked to quarantine. Some are even obtaining hotel rooms for first responders that they believe might be infected to quarantine, so they won't be with their families if they don't want to be, or if there's something real serious. Again, you can see the list there. They're looking at communication centers. Are asking now when you call in certain questions so they'll know if there's a problem and they can ensure social distancing. You're seeing police departments are modifying and changing their staffing plans. They're putting specialized units into the field. You're probably going to see a lot less traffic stops. Things that are misdemeanors aren't going to be addressed. They're having to respond to some of the panic. Some are having to go to Costco's and grocery stores and things that are being overrun. There's just a different way of doing it. And they're actually going to ask some folks to come outside when you go to a call so they can talk to you. There's just a lot of things that are changing in the way that the police services are. And again, police officers are being quarantined. They're also the ones that are having to violate the social distancing because their job calls for that. So you're going to see, even when to us as a public, there's some real changes. Our roll calls, we're doing roll calls outside. Some places they're splitting them up. There's modified shifts, and so you're going to see a lot of changes for those of us that are in law enforcement. The key again is not to panic and practice the points that Dr. Botz has talked about at home and in the workplace, and we'll limit the disease spreading. Again, these are some things that we can all do. Great work by Dr. Botz and what he put forth, and then some of the panelists that are coming up. But also, I would stress we need to talk to our children, answer their questions. Understand they're fearful. They may not always say something, so you need to talk to them, especially if one of the family members has to be self-quarantined and what that means. And again, teach them basic hygiene practices. Make sure it's a family thing. Everybody's coming together. They're working on this together. In your communities, set up a network, support each other, know who's there, who needs help, so you can share in things. And again, Dr. Botz pointed out the empty shelves. Let's be sensible about how we're going about our business and thinking of each other. So with that, I'll turn it back to you.
Thank you very much, Chief. And we'll go, Randy Steiner, and we'll kind of come back to you, Chief. And we're going to have Q&A over in the right panel of the WebEx. Those that haven't used WebEx before, there's a Q&A area. I'll moderate questions from that, and we'll go to Randy Steiner, who's the Director of Emergency Management Director at the University of California at Irvine. Randy has been a terrific asset to us in our community, also a scout leader, and helped us run a search and rescue program for Boy Scouts. He's responsible for the University of California. Irvine works with and under the police department. We'll rapidly go to Dr. Chris Fox, who's the emergency medicine chairman after Randy. Randy, anything you want to add from a perspective of what's happening at our universities locally and you standing up your incident command centers?
Yeah, Chuck, thank you very much, and thank you, everybody, for being involved in this. This is an outstanding program. UCI, currently we are fully stood up. Our EOC is fully activated, and we are supporting the university on a number of issues. We began really tracking this pretty early on in late January, and really recognized, that we may have an issue with this disease moving forward. And so we've been really planning and doing tabletop exercises and getting the university prepared. We're, have been facing some very large-scale challenges in terms of social distancing, creating isolation space, creating quarantine space, and just planning for that. We've been very fortunate at UCI that we haven't actually had a case on the campus. We know this could change at any time, but we have been very, very fortunate in that regard. Nevertheless, we have been putting extensive efforts into planning. These are the same issues as every university is experiencing. We've been in close contact with the UC system through this whole progression of this incident, and have really been engaged in the university sort of web around the country. All the universities are dealing with the same issues, and it's a very, very serious impact on the university and the higher education system in this country. But we are doing many of the issues we have, particularly at a university like UCI, are around our research capability. We have, other facilities on campus. Closing the campus is not an option, not to mention that we have a number of students who have no place else to go, that have to stay at the university, and that we have to take care of. So we're in the process of, if we can send our students home. Our faculty, staff are on minimal assignments at the university. Most people are working from home. We're telecommuting. We're doing a lot of meetings over Zoom, and we're continuing to really try and flatten that curve with the social distancing on campus. Most of our facilities are closed, so students are really going to be fairly isolated around the campus. Creating that isolation space is a challenge. We're also setting up mobile testing sites, both at UCI, the main campus, and at the medical center in Orange. So we are taking this seriously. We have from the get-go. Everything that's been discussed with regard to social distancing and hygiene and protecting yourself is super important. One thing we're finding out, having been in sustained EOC operations for going on 2 weeks now, is the big need, the huge need to understand that this is a marathon and not a sprint, and getting our staff and our EOC responders to get the rest that they can as they can. And we're really trying to look at this in the long term. That's about it.
Yeah, Randy, I know you need it. We thank you for being live here today. We know that you're really, really challenged, and we really appreciate it. And we will bring you back. I think we're going to be. We've been asked to continue. We've been getting streaming folks saying we want more. We'd like to thank you and like to invite you to come back, Randy, so we can understand more about what we could do for our college students and our communities. But thank you. I know you need to go to the next critical emergency meeting. So thank you.
You're welcome, Chuck. Thanks for the good work.
You bet. And thank you for all you do for your officers and for the Scout community. So I'm going to just cover a quick sum up on protecting our seniors and our vulnerable patients and families, and then we'll go to our reactor group. This is a picture of those I hold closest and dear to me: my son, who's 14, my wife, and my mom, who was 99 a couple of weeks ago. And it's absolutely critical that we take the time to really focus on how we can help those that we're close to, and especially those with underlying conditions and the age-related issues. We put together a checklist, a supply checklist and a process checklist you can download from the website. These are the topics. I'm not going to read them completely, but it's absolutely critical when we're trying to take care of people, and we have a wonderful chairman of our association here, Steve Samuel, in my community, who jumped on emergency preparedness, and we're working, how can we take care of the people in our church? In our church, Saddleback Church is a big church that I go to in our community, and how do we do it how do we help take care of the seniors? Prescriptions and medications on hand, making sure to get those, get the next 90 days if you can't, then figure out when you can keep refilling them and getting them to the seniors without having them to get in a car. If you can get a 90 to 120 days, great. The over-the-counter medications, we heard from Dr. Botz, the flu-like symptoms that we're going to have to address. Thermometers are really critical so we can monitor their temperature, and keep in mind that adults that are of later age don't spike as much of a temperature. And Chris, I'd like to have you and Greg, because you're practicing physicians. I'm a retired radiation oncologist, biomedical engineer, but if you all can kind of address some of the things to look for in our seniors during our Q&A, it would be great. Food and bottled water, flashlights and batteries. Candles are dangerous, and with our seniors, if we have flashlights and batteries, periodically we have power go out here on the West Coast. Cleaning and disinfectant supplies. Dr. Botz addressed the dilutions of bleach to water, and the fact that soap really, really works well because of the fat layer of the virus. That we know how soap disrupts grease when we wash our dishes. It does the same thing to the virus. Kitchen rubber gloves, and having those in case somebody is sick in our family, and making sure that we wipe down things that come into the home. And USA Today, my wife just sent me an article that just came out today, which cites the New England Journal of Medicine article about how long the virus can remain in the air, for up to 3 hours, and the various surfaces. It can be anywhere from 72 hours to 9 days. Full tanks of gas. People may get sick in the supply chain. It's not that it'll run out. It's just that there may be a delay, and you don't want to be running on empty or having anybody running on empty. And then if there's a disruption in our supply chain for any period of time, we want to make sure to do that. Reading materials and recordings. The internet and cable may periodically go down, and making sure our faith-based organizations, terrific opportunity to serve our faith-based community. The process checklist, in case of emergency contact list. We should all have this. We teach this with our MedTech course. Who do we contact if you're in an accident, how about sudden cardiac arrest? But with our seniors, they may be living by themselves. Who do we contact, or who should be contacted? All their caregivers' contact information, the doctors, nurse practitioners, pharmacists, everyone. The local support individuals, we're doing that right in our community now. Who can the seniors can rely on so they don't have to get in the car and go to the grocery store? How can we divide that up? If I get sick plan, if I get sick, what should I know about the signs and symptoms? And Greg, you might address the immune-compromised patients that you are dealing with, who've had chemotherapy, radiation, or maybe just healing after such care for cancer. Hospital of choice. We want to make sure that people know that if you've been treated at the same hospital for multiple admissions, that's where you should go, because your medical records are absolutely vital, and keeping medical records, a set of medical records at home is key. A medical power of attorney, even for college students who are over 18, families have a hard time getting the medical records and understanding what's going on for a college student who we still think maybe are dependent, and yet they are over the age of 18. So having a medical power of attorney for everybody of all ages to make decisions for you if you can't make them. What are the regular expenses and payment mechanism for bills if somebody gets hospitalized? What about the regular home chores like pet care, watering, and the other things in the home? And then daily check-in calls for our seniors, because things can evolve. And I think, Greg, you and I, and I'm sure Chris and our other leaders of MedTech have taught us about return precautions. When you have to return to caregivers, seniors often delay and wait too long. Food replenishment processes, Meals on Wheels, and then the really critical issue, how do you create a sick room in your house, and how do you prepare that room in case somebody gets sick and make sure that we can keep everyone else from being at risk? And then my last slide now before going to, and we'll go to our reactor panel now. My favorite surf shop out here is called Killer Day in a Surf Shop, and my family, my son is an avid surfer, and that's a modification of Flatten the Curve, is shelter in place maybe in the curl or in the curve. I took this picture at our beach yesterday. These millennials are not maintaining social distance. They're playing, they're touching things, they're in contact. And one of the key vectors that we've got to focus on is making sure that it maybe make or break the social distance of our kids. So what I'd like to do now, and I know, Chris, I'm going to advance to Dr. Chris Fox, a fabulous physician in our community on the West Coast. Dr. Fox is the chairman of the Department of Emergency Medicine at the University of California, Irvine. Absolutely terrific contributor to our community, and one of the few emergency medicine doctors who's been fellowship trained and now training doctors all over the world on how to use ultrasound to save the lives of people in emergency medicine. Chris, thank you so much for taking time. We pre-recorded you, but you've taken time away from your busy practice at UCI. Anything you want to react to, add to, or comment on, we would love to have your comments. Thank you.
Sure. Thank you, Chuck, and thanks to the other speakers. Can you guys hear me? Make sure.
Yes, sir, we can. Yep, we can hear you.
Okay, cool. Thanks to the other speakers, particularly Dr. Botz. That was a very thorough discussion on the latest with COVID-19. So at UC Irvine, we have the county's only level 1 trauma center. We're obviously bracing ourselves for whatever comes at us with coronavirus. Currently in the county, there's only 29 documented positive tests for coronavirus. Half of those are people under the age of 50, and as has already been mentioned, the younger population tends to do pretty well with coronavirus. It's the older patients with comorbidities. Now, one of the things you're probably wondering is, what if you are sick, and how do you decide when to come to the emergency department to seek care? And we're trying to tell people to really use the emergency department for the correct indications. And sometimes it's hard to know, to lay people to know whether it's time to go or not. I probably get more text messages about, do I go, do I not go? Do I stay or do I go? It's like, and so I think the main thing is, if you're feeling fever and a cough, and you're thinking to yourself, I may have coronavirus, but that's it. You don't have any other symptoms. You're not feeling short of breath. You're not feeling weak. You're feeling like you have the flu. And I think that's okay to stay home and isolate yourself and take care of yourself with all the things we're talking about here, and try to isolate yourself from your family as best as possible to limit the spread. But if you are feeling short of breath or weak, then you could be falling into that small percentage of people who are actually going to progress to a much more severe illness, and we really want you to come to the ER. We are ready. We have a whole split flow approach that we're doing for COVID, non-COVID patients, concerned patients who come in through our emergency department. I believe a lot of other ERs are doing the same thing around our county, and we have everything set up and ready to treat you. We have currently plenty of ventilators, and the county is ready. And all the discussion about flattening the curve is exactly that, is so that we will continue to have ventilators available throughout the course of COVID, however long that may be. We are preparing for a marathon, but every day we're ready to sprint at any moment. So there's a whole bunch of metaphors I could use right now, but I'll try not to do that. Yeah, if you're feeling like you are just having a trouble catching your breath, you're short of breath, that could mean that in you, the virus is taking a particularly nasty course, as it does with about 5% of people. And so that's the time when you really need to get yourself to the hospital, and then we could start to support you. We do things like start an IV and give you fluids, and we do give you oxygen and things like that. And so certainly if you know that your oxygen level is low because you have a way to detect that with a pulse oximeter, in fact, you can buy them on Amazon for about $20, I think, if they're not sold out, or you know somebody who has a pulse oximeter, once it reaches below 90 to 93%, that's somebody we would probably admit to the hospital. I'll stop right there for anything.
Thank you, Chris. And I'm going to come back to Greg as well. We have some questions from our law enforcement community. One, I'm going to just hit you with three of them. Is when our law enforcement folks or our volunteers that are caring for someone and they have to go into the home, are there any signs to look for when you're in someone's home? That's one of the questions. How do we deal with people that have mental illnesses that now might be positive? And what about our law enforcement folks that are forced to go into the homeless encampments? I think, Greg, you talked about carrying a mask and putting it on somebody who might be at risk and that kind of thing. Any tips for our law enforcement, Chris? And I'll go back to Greg, and then we'll keep tracking with our reactors. Chris?
Tips for law enforcement?
Yes.
Well, yeah, I mean, if somebody is, coughing or there's a fever, then that's certainly somebody who you would want to place a mask on to limit their ability to spread the droplets of the COVID. So that's somebody who I would recommend. Anybody who comes in with a cough, of course, and putting a mask on. So in somebody in law enforcement, another, first responder certainly has access to those surgical masks, and it's a very simple those little yellow masks you see everywhere. I would have them wear that straight away.
Because there's a lot of confusion about masks and why it's important with somebody who's sick to put the mask on, and that might not necessarily be an N95 mask, but there is some protection afforded for those people who are sick. Greg, do you want to kind of jump in on that? And I'm going to move to our kind of reactor panel. Thank you, Chris, and feel free to weigh in here. We're going to kind of go through everybody if you can hang in with us. Greg, are you are you on?
Yeah, I'm here.
Yeah.
I think the challenge is that our law enforcement first responders often don't have the choice of standing back and watching when things are happening, especially if there are people in harm's way. Obviously wearing gloves and a mask if it's possible, paying attention to hand hygiene and things like that are helpful. And as I said, if the material doesn't get into your mucous membranes, your eyes, your nose, your mouth, the likelihood that you'll be infected is relatively low. In circumstances where you know you're going to enter into an area that's at high risk for having infected people, you might want to think about putting on Tyvek suits or coveralls, and then put your duty gear on over that. Use the sort of PPE perhaps that one would use if you were going into a place that had hazmat conditions as well. That's a judgment call based on what the circumstances are, and obviously I feel strongly for our law enforcement partners that don't have a choice but have to step in and intervene when people are in harm's way.
Thank you, Greg. I'm going to I know we have a lot of parents We have a lot of parents on right now that are perhaps maybe not law enforcement, but you gave such a great background, I think, for everybody, Greg. We'll come back to some of the specifics about the testing and what to do over the course of the illness, and we'll come back to that. But I want to go to David Bash, because not only is David a lower school educator, he's an award-winning teacher who's had numerous awards, our Orange County Teacher of the Year, also my dear friend and an Eagle Scout who's also a scout leader with us in the community, and actually saved the first life with our MedTech program just 48 hours after learning one of the skills. David, what's your reaction? Anything you want to help us with a bit of a perspective from the educators and the teachers that we know that are on, and also the administrators from our school districts who are on as well, who are joining our MedTech team?
Absolutely, Chuck. Good morning. Thank you for having me on. Can you hear me okay, Chuck?
Yes, sir. Go ahead.
Yes. Okay. Excellent. So, first of all, thank you to all the presenters. This information has just been fantastic. And I never realized how much I touched my face since being on the WebEx here. So as a parent and an educator, the perspective I'm going to try to give is I'm at home right now with 3 young children. We're trying to maintain some sort of sense of normalcy with their schooling and their education. And I think for that, trying to establish routines are key. My family, we instituted a time where the kids have to be up, they have to brush their teeth, they have to get out of their pajamas, put on normal day clothes before we start our school day at home. It's really important for students and families to establish a consistent workspace for kids where they can do their readings, where they can do their writings, their journal prompts, somewhere that has good lighting if it's internet based, somewhere they can plug their computer in because you might be online for a considerable amount of time. As a parent, I'm going to really, and as from an educator's perspective, just be creative. The amount of online resources that schools are able to give to parents, I know it varies widely. Some schools are giving parents quite a few online resources. Other schools are really not doing much. So be creative. Go online. There are a lot of free resources right now. I know that abcmouse.com is a really good educational resource for younger children. A lot of authors, a lot of illustrators are doing free video lessons on YouTube that kids can still engage in. If your school is offering you online resources, please utilize them. I can tell you from perspective that my wife and I, who's an educator, we're putting in tremendous amount of time uploading activities to keep kids up to date, keep them engaged, and to keep school moving forward. If your school, which I know quite a few public schools are unable to do, giving you resources, just having your children read independently at home for as much as they can, and also co-reading, having your kids sit with you if they're young, putting them on your lap. Research has shown that engagement and brain function goes up considerably if kids are just sitting on your lap with you while reading stories. Reading is very important. Having kids journal, and I know Chief Adcox mentioned really eliciting your children's emotions, having them journal the way they're feeling. Have open conversations, honest conversations with children. My son is in preschool, and we're having honest conversations about the virus, about ways that he can keep himself and his family safe. So really honoring your children's emotions is very important. They're nervous. They see the stress going on with everybody. Talk to them about it. Give them outlets, whether that be verbal conversations or writing. Daily journals, I said. Another great thing that we're having my children do today, they're having a video play date. We're going to have a FaceTime play date where the kids are going to do some kind of a dance party. So giving them opportunities to see and hear from their friends is really important. That's a great way for them to kind of stay engaged. And, just being flexible and doing what you can at home. I'm trying to do as many science activities with my kids, building activities, building roller coasters out of tubing, using, cardstock to make bridges and arches and things for my kids is the best you can do. Try to create a sense of normalcy. Routine is key. And keep up with those online resources. And if you don't have any of those available, reading and writing with your kids at home are fantastic.
So, David, stay on just for a minute. I'm going to come back. So not only are you a lower school, in my book, superstar teacher, I love to attend your classes. I love to teach with you, and we teach our after-school program together with our MedTech program, and it would not exist without you, and you do such a great job. But now let's talk about this older group. I just put the slide up that I took yesterday at our beach here in the community, and a lot of the younger people do not understand the critical nature of social distance. And I want to come to Greg and then back to Chris, if you can hang in with us, on tips, what we need to do to inspire our younger people, because if it turns out, as some people are proposing, that the asymptomatic or pre-symptomatic kids, like my son's 14, loves to be with his buddies. These guys love to get together as groups. A lot of people in Italy felt like, oh, we're quarantined, that means we can all go skiing together. And they had a huge outbreak in the resorts in northern Italy and southern Switzerland because they did not adhere to the social distance. Any tips for us with the older kids that are in their teens, David, because you're one of the real, you inspire our scouts, because you and I help teach them in the teens, and they really listen to you. Any tips there? And then Greg, tips from you and from you, Chris, on the parents that we have online right now. We're having a hard time trying to keep them apart and take this seriously, because there's this myth that they don't get it. And what they don't realize is if the pre-symptomatic and asymptomatic group that may have it can give it to our older people. This is one of the critical issues on being able to flatten the curve. David?
So my response to that is twofold. Number one is, just like I'm gonna reinforce what Chief Adcox had to say, is we have to be honest and talk with our kids about this, and not dancing around the subject, especially with the older, the 14 and older, and even 5 and up. You just be honest with them, explain to them the importance of social distancing. I think some of the slides that you had in the slide deck were fantastic with what Dr. Botz was showing, how the particles drop after 6 feet. The kind of the funny satirical slide with the man with the disc around him. Kids our brains like to see pictures, and showing those slides, showing those pictures, giving them some sort of some proof, and having honest conversations with them and say, look, guys, I know it's hard to be stuck inside. I know it's hard to keep away from your friends. You're social creatures. Your brain and your body are telling you to be social. But at this point, we have to show some leadership. We have to teach and educate and be honest with them. And creating some sort of a schedule where they can FaceTime. I think the video conferencing and the FaceTiming that we've got today is going to be a great benefit to us. That setting that up, having them text their friends, set up times when they can see each other, talk to one another, and create that sense of normalcy through that is helpful. But we have to be honest with them and explain to them that this is dangerous. We all need to be doing our parts for ourselves in the community, and keeping our distance is the best thing that you can do to avoid the spread.
Greg, you've got a college student, and then we'll go to Chris. Anything you want to add, Chief? And I want to draw your attention to the survey questions. Please fill out the survey. If you'd like another webinar on responding to coronavirus, and perhaps specifically how to care for someone in your family, we'll do another one. And pick the topics you wish there, free text entry. So in the right panel, you'll find a place to be able to click on and tell us. If you really want it, give us a 10. If you don't, absolutely don't see no value, a 1, anywhere in between, and just type in free text entry, anything you'd like us to cover. The first question is, would you like another webinar, and what would you like in that webinar? And the second question is, I'm interested in video updates on corona threat. If you're so busy and it's hard to watch a webinar, but you'd like 3 or 4 minute videos on the latest issues, we're happy to do it. Our team is going to work right through this whole event and try to keep you informed on this fast-moving target. So these are the 2 questions that we want to cover. Go to you, Greg, and then to Dr. Fox.
Well, Chuck, as you mentioned,
like
I have a college-age student, and it defies me sometimes to understand the logic that they use in approaching social issues or things, and that's part of maturing and growing up. But my wife and I had a very honest and direct talk with her about the fact that we're not worried about her health. We think that if she gets the coronavirus, she'll be just fine. But she lives in proximity to her elderly grandparents, both my mother and my wife's parents, and we've made very clear that her actions in getting in contact with people that might spread this is a direct threat to her grandparents, and we have reinforced social distancing, isolation, self-quarantine, the good practices of hand hygiene, and just making good decisions to try to reduce the risk to the community and specifically to our family.
Well, thanks. Last night, every night I say our prayers with my 14-year-old, and in the morning we have a prayer journal and we say our prayers, and that was the context we used to be able to have this conversation. And last night we had the conversation about the forecasting of how many people may pass away in Orange County. And Charlie, my son, was shocked when he said, "Is it as bad as 9/11?" I said, "Charlie, it could be much worse. If you look at the national forecasts and then just look at the forecasted numbers and the probabilistic risk for deaths just in our Orange County of 3.1 million people, it's many times what a 9/11 was." And we did it in terms of our prayer time and having that conversation. So thank you for reinforcing that, David, because that's how we broached it. Chris, any tips on what to do with our teens and our bulletproof 20s and 30-year-olds that are still congregating?
Yeah, this is the problem, is that a lot of people are taking the social distancing very seriously, but then there's like this subset of people who are sort of ignoring it. And I think it's important to remember that the people at most risk here are the people in long-term care facilities. My mom is in assisted living. I'm keeping my family away from her for the next, several weeks. Kind of playing it day, week by week here. But, I have a 12-year-old boy who's got a tremendous amount of energy all the time. And I'm trying to find things for him to do to keep him active, yet also not put him in harm's way for other things like, trauma, because he's not going to, as this starts to evolve, we may not have the same access to emergency care that we're used to having. And so I feel like, normally the trampoline is a great place for him to get his energy out, but kind of shying away from that as the weeks come here, thinking it's better to sort of do a lot of outdoor activities they're sort of less risky. And so I like
respond and kind of
off the streets, but on the bike paths. I like getting out into a soccer field and just sort of maintaining social distancing, but running around and kicking a ball around with a friend or two, I think is fine, as long as they stay away from each other and just on an open field like that. I think that's all stuff that people should be doing, is being outside. I went for a run yesterday and I saw a ton of people running and being outside, riding bikes, and tiny little groups of 1 and 2 people. So I think that's the kind of thing, just kind of getting outside. And as Mr. Besk was saying, absolutely reading as much as you can, and journaling, that kind of stuff, and maintaining the same sort of schedule at home, with going to bed at the right time and stuff.
Well, great. Kyle, I'm just giving you a heads up. We're going to play the short clip of Tom Renner, and I'll introduce him. He was on duty as a lifeguard, but we know we have a lot of lifeguards, and we have our MedTech lifeguard surf program, and we've got lifeguards in multiple states that work with us on our first responder MedTech program to teach everyone how to maintain bystander rescue care. So I'll come back to you in just a moment. And we're going a little over the time that we usually do. This is such a critical time, and I'm going to just take a moment to give Dan, if you have something short you want to say. I know we've run over time, but you always have some great thoughts. Any reaction, Dan, that you might have before we go to Tommy and then go to Jennifer?
Just one quick comment. You commented about seniors. And that's I'm a 77-year-old senior. I'm in good shape. I'm doing all the stuff that we're supposed to be doing. I'm going to go for a long walk right now, social distancing. But I would remind everybody to touch base with the seniors in your world, in your space, in your family. in your church, in your community. I happen to be a single guy. Many seniors are single in their homes, and they're just scared to death. They don't know what to do.
Thank you, Dan. And we have if you could mute, I can hear some feedback from your machine. We'll be posting this checklist that Dr. Botz and I went over this morning that I've been creating over the last 72 hours. We'll probably add more resources, more videos on the website. But thank you for drawing the attention to our seniors for sure. If you're ready, Kyle, if we could roll, I'll just introduce Tommy real quick. Thomas Renner is actually he was a superstar water polo player, has an undergraduate degree from Johns Hopkins in public health, and is probably one of the best instructors I've ever worked with. And he instructs here on the West Coast in Laguna Beach, is an instructor, has been helping us instruct our scouts in search and rescue. And I just asked him as an EMT, as an emergency medical technician, what he'd like to share. He is on duty right now. So, Kyle, could you just roll a short clip of Tommy, and then we'll go to Jennifer. Tom, can you please tell us what our EMTs need to know?
So it actually begins with public safety dispatch. They're going to be altering their questions to find out if there is a suspected patient of any respiratory disease. That patient is then considered a patient under investigation, or PUI, and the dispatchers will allow the EMTs and first responders to don proper personal protective equipment. So that leads to my next point, that EMTs should be wearing the interim guidance for EMS systems, guidelines for personal protective equipment, which include face shield, goggles, N95 respirator or surgical mask, isolation gown, and gloves.
And these are CDC guidelines.
That's correct.
Great, and they can find that on the CDC site. Now, as a lifeguard educator and trainer and master trainer with MedTech, what do our lifeguards need to know?
With many schools and businesses closing, our beaches are going to become busy. Our lifeguards need to help practice social distancing, remain 6 feet away, stay at home if you're sick, and wash your hands as often as possible for longer than 20 seconds.
Great, and soap and water is a powerful deterrent because of the lipid layer of the virus. Well, listen, thank you so much, Tom.
Thank you.
Great. So as we move to our close, and Jennifer, we just because we're over on time, please feel free to kind of reinforce anything you heard. Jennifer is one of our superstar patient advocates, as Dan is a published author and part of our Saturday morning team that's now met for over a decade every other Saturday morning. And it was their group and our network that actually pushed the hospital-acquired conditions program through the government, because we were able to get everyone in the community to respond. It's saved more than 20,000 lives just in 2 years, and over the longer period of time, we don't know how long, and billions of dollars. But it shows that our country works and that we can influence our government to do good things. And so thank you, Jennifer, for your contribution and for waiting to the end here to make your comments. And Jennifer, would you close us? I'll let Jennifer, we always like the patients and families to have the last word. So God bless all of you. If you want more webinars, we're happy to do it. Respond to the survey, and any questions you can submit to us, and we'll be able to respond to you on the website. So Jennifer, your comments and close, and I want to thank everybody, and we'll just let Jennifer close us out. And speakers, stay in the ready room, and we'll do a quick process improvement loop on what we could do better next time. Go ahead, Jennifer. Thank you for all you do.
Thank you, Dr. Denham. What a wonderful webinar. I learned so much, and I have to thank all of our speakers for your wisdom and your information about this pandemic that we're experiencing. I just want to have a message for the families that are listening. Parents, enjoy your children, enjoy your family. Get back to basics. Go outside, take a walk, get some fresh air, ride bicycles like some of our speakers were talking about, play board games, And try not to worry. We have a wonderful, wonderful staff of medical clinicians, providers all over our country with our safety as their number one goal. Keep them all in your prayers. They're heroes. And do everything that you can to help them and assist them to make their jobs easier at a time like this. Again, keep our faith. And again, thank you so much for having me here today and giving the opportunity to the many people listening to this webinar. As I always say, I urge everyone to share the recording and spread it and get as many of your colleagues and friends to come to future webinars and listen to past webinars. Thank you all. God bless. Be well, stay well, and please listen. If nothing else, please listen to our clinicians and our providers. They are trying to protect us. Thank you again.
Thank you so much, Jennifer, and God bless, and that ends our webinar.